The purpose of our care rounds is to put our patients and their families at the center of their care. CARE stands for Communicate, Anticipate, Respect, and Experience. Our care rounds occur during the morning time, during our sacred time, in which we go to the bedside and we discuss and communicate a holistic plan of care. Caring science is the foundation of our care round. Care rounds encompass Caritas process number 2, as the team is authentically present as they develop a holistic plan of care. Caritas process number 4, as the patients and families feel that we are building trust and confidence in our care with our care rounds. And also Caritas process 6, 7, and 8, as we are creatively using ourselves to apply genuine teaching learning experiences, and in doing so, creating a healing environment.
In the beginning, when we began talking about the implementation of the bedside rounding or care rounding, we started out by having bi-weekly meetings with people who were the core part of the implementation team. We developed a data collection form that focused on the number of cases we actually rounded on, how many minutes it took for each case, and also looked at variables such as having the family in the room or having the patient in isolation. We relied heavily on the Plan, Do, Study, Act model as well as small dose of change approach to help hardwire and spread our change. The data collection information was very useful in overcoming resistance to change because we were able to reliably and credibly communicate to our stakeholders that rounds didn't take more than 5 minutes or so on average per case, and that we reliably completed rounding on 10 patients within an hour. Toward the end of the implementation time period, we backed away from data collection and focused on collecting feedback from patients about how they perceived the rounding process. So the nurse managers and the assistants rounded on patients regularly to collect their feedback and evaluate their perception. Generally and on the whole, it was very, very positive, and people really like to be included in their care in this way and to be able to offer input and ask questions in real time.
For HBS, Care Round is an opportunity to discuss all aspects of patient care, not only during their hospital stay, but also when they are ready to be discharged from the hospital to next level of care in a very cohesive way. During the care rounds, we also involve patients and their family in discussing the plan of the day and also in the decision-making process with all the team members, including the MD, their primary nurse, social worker, and patient care coordinator, which is a very rewarding and satisfying experience for everybody in the team, and which is the main core of the care rounds.
Oh, I need to call my sister.
Hey sis, yeah, I'm on my way. I'm taking the stairs. I won't be late. She had to be on my good floor.
Hi, I'm Jackie. How are you?
I'm well.
Good. I'm Adrian. I'm your PCT for today.
Oh, you're so lovely.
Oh, thank you. I'd like to help you with your morning care.
Sure. You know, I really want to freshen up because of their care rounds.
Okay. Yeah, let's get ready.
I feel so much more human now.
You guys ready for care rounds in 15?
Come in.
Hi Jackie, can we come in for care rounds? We're here for care rounds with your doctor and the care team.
Awesome.
So this is Jackie Buckley, and this is her sister Mo. This is Dr. G.
Dr. G.
This is Elsa. She's your patient care coordinator. And this is Margarita, your social worker. We're going to talk a little bit about why you're here in your plan of care. So Jackie came to the emergency room yesterday complaining of chest pain. She's a 45-year-old female. All of her labs have been within normal limits, and her heart rate has been at a good rate. She wears a CPAP at home, but the mask doesn't fit really well, so she's been having a hard time with that. She's also very eager to go home because she wants to go back to work. She also had a normal bowel movement and a peripheral IV.
I hear that you have chest pain. I had the chance to review all your data and everything was looking okay. but I'm still concerned that there's a risk of coronary disease, so I'm going to have you do a stress test. If that is negative, you can go home.
Can I go home first?
I think it's probably better to do the stress test first, making sure there's no cardiac issue. And if it's not related to your heart, the shortness of breath and chest pain may be related to stress.
I think it could be stress. And I'm more worried about getting back to work.
Yes.
I'm
I
not
can
sure.
stay here for about a week and help you.
A
And then
week?
we can get our brother to come from.
Absolutely. So we have a social worker here and
Yes.
patient care coordinator who can help you with these.
Great.
Hi, Elsa, I'm the patient care coordinator. I can help you with your CPAP. You don't have a mask that fits properly?
I hate it.
Okay. So you haven't been using it?
No.
Okay. So we'll go ahead and get you the right type of mask ordered for you. all right?
Yes.
And I'll be able to help you with the paperwork for your brother to be able to come and stay with you.
Oh, that'd be great.
Do you have any other questions about anything?
So I will have the test, get the mask,
Yes.
and get my brother. Thank you so much.
It's nice pleasure to meet you and best of luck.
Thank you.
Nice to meet you too.
Yes.
Thank you. Thank you.
The care rounds are excellent. And I'll start by saying I've had 3 back surgeries here in the past. And during that time, I would have to wait on my doctors to get there. Never thinking, my doctor said he'll be here at 10, he comes at the end of whenever he could get there. Now, there's not a day gone by that they didn't come on time, they didn't bring their team, they didn't ask me the right questions, and they allowed me to ask my own questions and let me tell them about my body and how I felt. I never had to worry about it. And it's just been good. I love these people. They love me too.
Because I care.
I care.
I care.
I care.
We care!
We care!
We care!
We care. We care. They really do care.
As we are, what are we doing?